Hi, my name is Rhiannon Van Ostrand, and today I am presenting the World Health Organization's Global Emergency and Trauma Care Initiative. The World Health Organization, or WHO, is a nonprofit organization founded in 1948 with a goal to connect nations to promote the highest level of health for people around the world. Along with the headquarters location in Geneva, Switzerland, the WHO has 6 regional offices and over 150 country offices around the world. This organization is headed by a director general and 6 regional directors. The WHO includes 194 member states with over 8,000 health professionals, including epidemiologists, doctors, scientists, and managers. These professionals work together toward expanding universal health care and coordinate global responses to health emergencies and disasters. WHO's mission is to lead global efforts to improve the well-being of all people and allow everyone an equal chance to live a healthy life. One of WHO's targeted issues is universal health care, which includes universal emergency care. Many conditions require immediate and efficient emergency care, including obstetric and other surgical emergencies, infections, traumas, heart attacks, strokes, and acute exacerbations. Injury alone accounts for nearly 5 million deaths per year, and road traffic injury is the top killer of 5 to 29-year-olds. To reduce the negative impact of these emergencies, timely, accessible, and quality emergency care is needed. Providing emergency care systems can address nearly half of deaths and over a third of disability in low and middle income countries. Evidence shows that in low-resource settings, trained first responders and paramedics, better flow in emergency departments, and supervision of junior providers all lead to reduced mortality. To combat this issue, WHO initiated the Global Emergency and Trauma Care Initiative, or Geti, in January of 2019 to enhance global capabilities for providing quality emergency care and to promote awareness through a global campaign about its potential to save lives. Geti was initiated by WHO with the support from the AO Foundation. The AO Foundation is a nonprofit global network of surgeons involved in the promotion, innovation, and research for the surgical treatment of trauma and musculoskeletal disorders. One of the most important functions of Geti is to assess national emergency care systems of low and middle income countries for weaknesses so they can implement interventions to improve them. Geti assesses emergency care systems by addressing organization and resource utilization and by developing national plans and key policies, including the role of communities and financial barriers that prevent access to emergency care. The World Health Assembly is held annually in Geneva, Switzerland, as WHO's decision-making forum to discuss policies, programs, and budgets. In 2019, the member states unanimously passed the decision to include emergency and trauma care in the universal health coverage. This decision urged member states to carry out several important responsibilities. The member states will provide training to all frontline providers, including postgraduate training programs for doctors and nurses, training frontline providers in basic emergency care, and integrating emergency care training into undergraduate nursing and medical curricula. They will conduct assessments and identify gaps in emergency care systems. They will create policies for sustainable funding for universal access to safe, high-quality emergency care for all, without regard to socio-cultural factors. This includes providing care regardless of a patient's ability to pay prior to treatment. They will promote access to timely emergency care with appropriate equipment and capacity for management and diagnosis. They are to implement processes like triage and checklists, using a triage protocol in emergency departments to prioritize care based on a patient's needs rather than the order of arrival improves outcomes. Additionally, simple checklists can ensure that life-threatening conditions are recognized and that action is taken. They will work to improve awareness in communities so they can help deal with emergency situations. And they will prevent provider and patient discrimination and violence in the workplace. The WHO stated several ways to improve emergency care systems through Geti. The first is to implement low-cost systematic processes such as triage protocols and checklists, as mentioned before, and protocols that guide first responders to transfer the patient to the most appropriate facility. This avoids delays that could be fatal. Understanding how countries use emergency care is required to improve outcomes. Data on this information are lacking in low and middle income countries. Improving pre-hospital care through community-based provider training and staffed community ambulances has been shown to reduce mortality by 25 to 50% in some low and middle income countries. Geti works to improve emergency care workforces by providing training and education for providers and creating organized emergency plans. Most importantly, no individual should be denied care. Geti promotes equity by ensuring care is given to all populations, including those with disabilities, migrants, and refugees. Geti addresses several important social determinants of health. Access to healthcare is essential for timely treatment of many health conditions. Millions of deaths and long-term disabilities from injuries, infections, mental health conditions, acute exacerbations of non-communicable diseases, acute complications of pregnancy, and other emergencies could be prevented each year if emergency care existed and the patients could reach them in time. Geti works on providing emergency care in the most disadvantaged, hard-to-reach populations. Geti addresses socioeconomic status by ensuring that emergency services are provided and delivered despite ability to pay for services. A well-prepared emergency system is crucial for mitigating disasters and for improving delivery of emergency care to conflict-affected areas, including populations with increased violence and mental health conditions. This promotes safe and inclusive environments. Many providers in underdeveloped countries have not had received dedicated training or education for providing emergency care. So Geti provides undergraduate and postgraduate training for medical professionals in low-income countries. Additionally, education for bystanders and communities will help them identify, mitigate, and refer potential emergencies. Geti has a profound impact on both local and global populations. In local populations, Geti addresses the role of bystanders and communities in emergency care. This includes education for first aid skills, including basic life support and traumatic injuries. Geti achieves this by increasing awareness through educational and occupational programs. Geti also promotes access to healthcare in communities of all status and income without requiring payment prior to treatment, especially helping low-income and poverty-stricken communities. Geti strives to improve local and national emergency systems organization and resource utilization. This helps provide efficient care and cut costs associated with using resources that are not needed. Geti also assures that emergency care is available in communities that may not have access to primary care or preventative services. This is important for rural communities and for the disabled or elderly population, as they may need more assistance in getting primary care services. Geti has an important global impact as well. The Sustainable Development Goals are important for improving worldwide health, education, and equality. Many Sustainable Development Goals are not achievable without developing, sustaining, and improving the quality of emergency care systems. Emergency and trauma care addresses many global health conditions, including communicable disease outbreaks like the recent COVID-19 pandemic. Functioning emergency departments are required to achieve universal health care, which is an important goal of the World Health Organization. Geti helps prepare for national disasters and public health emergencies, especially in low to middle income countries. So in conclusion, emergency care serves as the first point of contact for many people around the world. In some settings, it may be the only available medical care, so a functioning emergency care system is crucial. It is important to address sociocultural barriers and other determinants of health that may prevent individuals from receiving timely and quality emergency care. Geti is an important initiative because it strives to achieve universal access to emergency care, which is an important step in gaining universal health coverage for all. Thanks for watching.